So I'm Dan. I'm from the rehab department. I'm one of the physical therapists. Physical therapists and occupational therapists both work with lymphedema. That's one of the areas where we sort of cross-train. Rehab in the context for the melanoma, rehab can get involved anywhere along the continuum of treatment. So we can be seen on the pre-op side or early in treatment, pre-radiation, during radiation, after surgery, in-house. So we can jump in anywhere, okay? As well as lifelong for some of the deficits that might happen as a result of treatments, okay? Lymphedema doesn't always happen in a void. Sometimes it's, example, post-surgically, post-radiation it might show up. Lymphedema can show up anywhere down the line, all right? You know, the risk will be there once it's set up, okay? And it can show up anywhere. So it might happen with other comorbidities like loss of range of motion, weakness. So some of the immunotherapy, you heard some of the responses, might cause weight loss because of the GI elements. Well, unfortunately, with some of that weight loss, a lot of it might be muscle mass going with it. Okay, so there's different elements that we'll address, that we'll look at, even though the main referral might have just been for lymphedema. Okay. All right. So first off, lymphedema, what? You've heard this several times already. Edema itself, the word edema just means swelling. All right. Lymphedema means you're getting swelling because something went wrong with the lymph system. There's lymphedema that can happen just because your lymphatic system didn't develop well. We're not dealing with that here, all right? And lymphedema can occur typically because of radiation or post-surgical, okay? Depending on what area is involved, okay, it can occur in any of the limbs, the arms, the legs, and the head and neck area, or the genitalia. So it just depends what area of the lymph system may have been impacted by the disease. If it's something on the trunk, it may have been an area that would go to the left armpit area, okay? And so anything in there, if they take out lymph nodes, could end up resulting with a risk factor for lymphedema. So we have our own little works. We have, basically, if I draw and quarter you, okay, so the top halves are usually going to go to both the armpits. I'm sorry, I can't hold this steady. Okay, and roughly the waist down is going to go to the inguinal, okay, or the groin nodes, and as well, so your top and bottom and right and left. What is the lymph system? Basically, it's a second drain system. Everyone sort of knows the heart pumps out the arteries, back the veins, out the arteries, back the veins. But that's not the whole story. We actually have two drainage systems, and the lymphatic is the second one. So why do we have two? Just as an analogy, everybody, you take out your garbage in the little white bag, tie it up, throw it out once or twice a week, right? Truck comes by. But what happens if you have to get rid of your refrigerator, okay, or an old mattress, all right? It doesn't go on that truck. So there's another truck that comes around once in a while, and so it's going to, they'll have more men, better equipment, so it doesn't come around as often, moves a little slower, okay? So your lymphatic system, it's the other truck. Okay, so it can process roughly a gallon, okay, roughly a gallon of fluid to process through your lymphatic system. And just be aware, anybody buys a gallon of milk, gallon of water, okay, gallon is roughly like 8.5 pounds, okay? So if you've got a backup of fluid is heavy. So if you're dragging this around on one of your legs, you can see it can impact. So this is where sometimes people will say, I have lymphedema if it's in their legs, okay? So the other thing it does, it helps maintain fluid balance in the interstitial space. I'll cover that a little better. It's responsible for proteins that hang out in that fluid around the gut. There's lots of nodes and vessels for fat absorption after meals. All right, and it's certainly part of the immune system. All right, so where does this fluid come from that goes into lymphatic? First off, it's not lymph fluid until it's actually in the lymph system, all right? So be aware that your body has approximately 37 trillion cells, all right? You can look that up on Google. All right, some of these cells can last from a few days up to a lifetime and never change out, all right? So there's no time to hook it up to the regular circulation. Not every one of 37 trillion cells, especially if it's only living for 2 days, you have 4 days, 2 weeks or something. There's no time to get its own personal hose in there. So we need a better system so every one of these cells can get the nutrients in and waste products out. Okay? So how do we do that? Well, everybody's had some soup. Yeah. So if you want a little seasoning, you want to throw in a little salt there. I mean, you don't take out the potato and salt the potato and take out the beef and salt the beef, right? You throw it in the broth. The broth gets to everything. So this interstitial fluid, that's the broth that's around all of the cells. Okay? So now, but once stuff goes into the cells, comes back out of the cells, now we need a way to reclaim it, and recycle it. Okay? And a lot of that, some of that can go back in the fast-moving regular circulation, arteries, veins. Okay, and other parts that have proteins, or, that cell that lived its 4-day life, it broke down and now has to get recaptured, recycled, and whatnot. Okay, so some of that stuff has to go on the other truck. Okay, the lymphatic system. All right, so why does it get impaired in oncology in our particular setting? Surgical removal of nodes, of vessels, or vessels get disrupted during surgery. Radiation injury, and this can be in the very acute phase, like while you're getting treatment, and the several weeks to months afterwards. But also there's long-term chronic effects. As they say, radiation is the gift that keeps on giving. So unfortunately, the lymphatic system can be sensitive to that under certain circumstances. One of those being not only from the surgery can you develop scar, fascial, soft tissue adhesions, decreased mobility, fibrosis. All right, that can happen to the fine vessels, to some of the nodes. So even though that node may have been left there, now if it's in getting hit with some radiation, it can still become impaired because now it can be a bit fibrotic. If right? And certainly the effect of tumor mass might be leaning or compressing on something and blocking flow. It's like stepping on the garden hose. If flow can't get through, you're going to get a backup. All right, so this is a little bit what it looks like. We have an arm or a limb. The arms and upper extremity is usually from the axilla or the armpit area if those nodes are impacted. All right, the legs are usually from the groin nodes. But it's not only the limb, it's also the trunk area. So remember, some of these melanomas are showing up on the trunk. Well, I mean, that's still something that wants to go over to the axilla on the upper half, okay, or to the groin on the lower half. So we need to be aware if they have to do for say a groin or an inguinal node dissection, then the trunk area can be at risk, but also, unfortunately, if the inguinal nodes, that also is where drainage from the genitalia comes from. So sometimes we can get issues in the perineal area, and edemas or can back up depending on where the scars are, and or where radiation hits. So especially if it's if the lower extremity or the inguinal was involved, or depending on where the actual site of tumor was, is there scar tissue? It can be blocking both the limb itself, some of the trunk, and or the perineal area in the lower half, and then anywhere on the upper trunk area and the arms on the upper half. Okay, so when you come in for lymphedema treatment, okay, or evaluation, the things that we look for regarding the lymphedema itself is going to be, we take measurements in volumes. We look at the texture of it. Is it fibrotic? Is it thick? Is it viscous? It's like, okay, it's got a different feel, a different heaviness to it. Okay, so like yogurt is going to feel different than pudding, okay, or milk's going to feel different than water. It's got a different texture and heaviness and weight. Okay, so we use our hands so we can assess some of that. Does it pit, or is it pretty, it refills back pretty easily? Is it super dense? Okay, meaning especially if it's more chronic, that can be more of an issue. The reason that there's a difference in that texture is there are more like proteins and bigger, thicker molecules and fibrotic, all right? And that's going to make it, you press in there, it's sort of like going in there, as opposed to something that's thinner and more fluid. We can get rid of thinner and more fluid easier and faster, okay, and it usually manages better. But when it gets harder and thicker, then it gets a little more involved as far as treatment and the aggressiveness of compression and other elements we have to do. What's the cosmesis, the symmetry, all right? You saw the two pictures, right and left, okay? There can be very substantial or very minimal. So what's the contour? Does it alter contours? Now there's some creases in there. You know, some of us have, you know, those little rolls in there. But that can be a problem because the texture in the surface area, if you've got two areas of skin now folding over, you can get entrapment in there. So we have to make sure we address skin care as one of those elements. Make sure, you know, if you've got, you know, some areas of density or fold over, you got to make sure you know how to clean there and you even know to look there. Because sometimes these areas don't have normal sensation anymore, depending on what the and where it is in regards to some of your other treatments medically. Okay, so again, the skin condition we're looking at. All right, the other things we look at when you walk in the door, what's your normal range of motion? You had surgery, you had, you know, say the axilla. Well, now I can't lift my arm up. I can't get in the cabin. I'm having, you know, trouble like pulling my T-shirt on and off. All right, so we look at you functionally, and like I said, lymphedema doesn't always exist in a void. All right, so we look at range of motion. We look at tests, at manual muscle testing. What's the strength of that? Things get short-circuited. Anybody had a knee replacement, okay, you know that quad just went to jelly, like after your surgery. And it takes a while, and you need to go back and retrain it and, you know, re-educate it and say, smarten back up. You've got a job to get back to. Well, sometimes that doesn't always happen. You know, like normal function, you start working with your abnormal function, and you never retrain it, re-stretch it. Some of the secondary impacts and the collateral damage, so to speak, from what's necessary surgically or medically. All right, general conditioning, weight loss. All of a sudden, you know, you're having to do the same tasks with 20% less muscle mass. Okay, you know, all of a sudden I had 10 guys on the job, now I have 5. All right, it makes a difference, right, in how well you can proceed. Gait and balance. The hips tend to, you know, they seem to be one of the first things to go. As far as strength, and you know your hips and your buttock area, and if you had surgery in there, well, that's what gets you up and out of a chair and climbs up the steps and gets you out of going from sitting to stand. So when that gets weak, all right, you've got a problem. And it's like if it's your hips that start to pull that, not your knees. Okay, so your knees might actually be pretty strong. Your ankles might still be pretty strong, but if you don't get up here and get that core and the abdomen and all that muscles around your pelvis and your hips, all right, you can have a problem with balance. You don't recover as quickly. You don't have that quick little, you know, the things you normally happen to keep you from falling. All right, harder to get up the stairs. And when it's harder work, you're more prone to fatigue. So not only are you just tired because you're tired from effect, you're tired because you're working so much harder with less. All right, the pelvic floor can be involved, certainly. Okay, and sensory sometimes gets involved, either, again, because of surgery or because of any of the medical treatments. So, and these are all things we look at because these are all things we can intervene in. All right, so treatments for lymphedema, complete decongestive therapy. I'll go a little more into that in a minute. Compression pumps, we don't usually like them without the context of lymph drainage to support. If you just squash it out of the leg, well, remember I said that, you know, the part of the trunk's involved in there. So you can squash it out of the leg all you want, but if they can't get out of the trunk area, now the trunk's going to get full. Okay, so we need to make sure you would supplement that with self-treatment. Surgically, if it's usually more chronic, then and depending on the size of it, there's actual surgical techniques that they can do. They can hook the lymph system directly up into the venous for drainage in certain circumstances, or they actually do lymph node transfers now. Okay, and we have physicians on staff that use both of those approaches. I'm sorry. Sorry. All right. We use other manual techniques that we can use to manage some of the fibrosis, the thickness, the density. Our hands are pretty powerful tools here. Okay, and then we teach you home versions to do some of this stuff. We sometimes use things like the laser if there's cording and webbing in the armpit in particular. Diuretics are sometimes prescribed. Usually this is they're given by, say, the primary care, but diuretics just for lymphedema doesn't really work. What happens is it gets rid of all the fluid, so it's like pouring all the broth out of that soup. and then all the gunky stuff is still left behind. It needs to be suspended and swirled and mixed around. Anybody, you go to one of your lunches and somebody brought in soup and they all dig out the bottom and all that's left is the broth, right? So you want to make sure that stuff needs to be suspended to go. So if it's only for the purpose of the lymphedema swelling, then it's not usually recommended. If it's because of some other cardiac issue or whatnot, then absolutely it's appropriate. Okay, so there's a medical caveat there. So complete decongestive therapy, manual techniques. Now this is manual lymph drainage, which actually physically, mechanically helps to stimulate flow. We help to redirect it. We try and teach it to take a detour. That groin's no good anymore, but guess what? I have a good groin over here, and I have a good armpit up there, and I can just send them on their way, and maybe they can say, oh, I got you. And they start traveling in different directions, and we help train that and help you sustain that with home techniques. All right, compression during active treatment. This is with bandaging or something. Now there's some Velcro. And also then once you've reduced enough, because bandaging is very dynamic. It's always a perfect fit. If you get a garment too soon, guess what? We reduce you, now you need to buy a new garment. They're expensive, and insurance doesn't always pay for all of it. All right, patient education, home management, lifestyle strategies, and certainly there's exercise. So manual lymph drainage, okay? It's not a bad feeling treatment. Ask anybody who's had it done, okay? Compression, they come in a wealth of colors once you get into the, she's had lifelong, this woman here, and she gets really funky. She really likes her fuchsias and her purples. She has tie-dye now, so they're really staying with it. Bear has he's got bandaging going on in there. Okay, he has a sleeve for an arm, so we've got garments. So the garments are for the maintenance. Like once we're done treating you, this is how, it's a lot easier to put this on and off in 5 minutes than take 20 minutes to wrap. Patient education, skin care, how to do self-bandaging themselves so that they can take a shower when they're home and then come back. All right, home exercise programs, how to do self-massage, teaching them about lymphedema so they know, why we're asking them to do this, why we're asking for compliance. All right, risk precautions, signs, symptoms of it returning, or how to monitor it. Remember, we come in anywhere, we're on the pre-op side, and some people, no matter what happens, no matter how much radiation they got, where they got it, what surgery was done, they're not going to get it. Their body just naturally found the detours, okay? We emphasize that lymphedema risk is a lifelong. So even if you don't have it after your surgery or, in the short course, there's certainly potential for it down the line, especially if there's radiation. And therapeutic exercises, because this is what stimulates flow. And along with compression, it says, I'm not going to let you reswell here. You've got to get that. Body doesn't like pressure. So it tries to help figure out and redevelop and these new pathways and detours that we're asking them for. Okay? Now, exercise, Dr. Buhler, I love that you had dragon boating on there. As a matter of fact, I'm racing up in Bucks County in dragon boat as soon as I leave here today. I missed my first race to be here. So anyway, exercise is really important to maintain strength, balance, skills, all these things that can deteriorate. And remember, life's one way. So they might be dealing with this when they're 40, 45, but, hopefully when they're 80, they're still going to be walking and getting up out of chairs and off the toilet and, going in the neighborhood and the community. So thank you very much.